My name is Amanda Hum, and I will be going over how to take proper hip x-rays. There are some different positioning aids you can use. Those include, you can use tie gauze for the leg, tape if you need to tape them together or to help with the tie gauze. We also have the V-tray to help keep them on their backs in ventral dorsal position. And then some other aids that sometimes help with positioning as well. The proper equipment to be wearing, the attire, would be to have your x-ray badge, to have your lead apron, both lead gloves, and your thyroid shield. In addition, for hip dysplasia, there are different medications that can be used. They do recommend sedation for most of the positioning, especially when you're on the VD trying to do your compression view. So in order to do that, we have dexdomitor, which is a sedative to help sedation. We also have propofol. As I said before, dexdomitor and propofol are two medications that can be used. Dexdomitor can be reversed with the antecedent, or atipamezole. Another big one, if they need other things done, we also can use isoflurane and oxygen at the same time, which would be kept in place with an endotracheal tube, so they would have to have an IV catheter in case they needed additional after propofol to use that. There are a few different views that can be taken. One is lateral. If you lay them in lateral recumbency, the leg closest to the cassette should be pulled a little cranial in order to kind of see the proper hip placement. Another one is ventral dorsal. You can place in a V-tray, depending on their body shape. If they're a little thinner, sometimes you need to use the V-tray. If they're a little wider and heavier dogs or heavier built dogs, you may be able to place them on their backs without the V-tray. And in order to do that, there are two different positions you can do in ventral dorsal position. You can do the frog legs, which would just kind of pull out like a frog. It would help with laxity. As well as the other one would be the extended, which means you would pull the legs in tight and roll them in to make sure to see where on the actual x-ray the hips are positioned. For pen hip, they do provide a more repeatable and reliable indication of how the dog's position of laxity on the hips are. It is easier. They do recommend more times than not sedating. They do require for their hips to have a standard view, a compression view with a neutral position, and then the distraction view, which would have something in place on the abdomen. This is Bella. She is a 6-year-old spayed female boxer. She will be our demonstrator today. Again, our proper gear, we have our thyroid shield, our lead apron, lead gloves, as well as our x-ray badge or dosimetry badge. Now in order to measure, we will do a couple different ways of measuring. This is the caliper. So in order to do the lateral view, we would measure right here about where the hip bones are, which is about 16 centimeters. And then when we lay her on her side, we'll measure how wide the hips would be, but here, as caudal as we can measure, she's about 17 centimeters. So I would adjust that on the machine. We would place her on her back, or if we did lateral position first, we would pick the side that we were more concerned about for her hips. So if we said it was her right leg would be laying down against the cassette. It would be a little cranial compared to the leg up, so you could see the difference in the hips. And then for the VD, the ideal one for pen hip, again, I will explain it before we do it. You will pull her hips down and then turn them in. We will not actually do that on her today because she is not sedated and it can be very painful. You would have the marker in to mark which side you're more focused on, whether you're in lateral or ventral dorsal position. Afterwards, if she was still asleep, you would wake her up, of course, with a reversal like antecedent, if you use dexdomitor, or you could let her wake up on her own if she's on isoflurane. Today we're going to use Big Dog. He is going to be our cooperative sedated patient. This is Big Dog. So first we would do a lateral recumbency. The leg of interest or hip of interest would be against the cassette, downside. It would also be, we have the hips even and aligned, with the leg on the cassette, which in this case is the right leg, would be cranial. For a ventral dorsal view, there is a frog leg view, which would kind of open the hips up a little wider, which is just like this. They can be placed in a V-tray if need be. The other option is to rotate the legs in and pull down. And in order to do this, we'd make sure that our hands are not in the field of view and would also be covered with gloves. And you want to have the proper density and collimation as well. Not too dark. You do want to make sure that you get all of the pelvis. You don't need to include the legs much, but just to show that you rotate them in. Most of a part of the femur should be showing.